Hi everybody. This is my first video in a little while. Apologies for that. It's been a busy summer, I'm sure for you too, and the exec team and myself have been using August really to ensure that we are getting as ready as we possibly can for the autumn winter period that's coming. I wanted to give you a bit of an update on that today, not least because you will know as well as I that we're starting to see rising rates of infections across the UK and in the south of Wales, with additional local restrictions coming in a number of places. Most recently, and on our patch in Llanelli, clearly that's making us all a little bit nervous. We knew this virus had never gone away, but I think it's maybe a reminder to us all just how quickly it can spread, that the numbers can go up so very quickly, and we really saw that in Llanelli recently. And I'm really thankful to the work of the local authority and indeed the local population of Llanelli to be standing side by side with us to get on top of this virus and these clusters that we've been seeing. I would say as well that whilst we may be feeling a bit nervous about what's coming and knowing we're going to have a busy winter, I think we are in a much better place now than we were back in February and March of this year when this was all very new. We've been building our local test and trace service that's been led on behalf of the Health Board by Ros Jervis, the Director of Public Health, but fantastic joint working with the local authorities who are running the contact tracing teams. That's enabling us to spot outbreaks, spot clusters early enough to be able to break the lines of transmission by asking people to self-isolate and get tests. And of course, we also have much greater access to testing now, and Alison Shakeshaft has done some fantastic work, most recently in Llanelli, to expand the amount of testing there. But we're doing so much more than we were previously, which is part of the reason why we're seeing higher numbers, because back in February and March, there were probably much higher levels of infection than we were capturing with the testing capacity that we had back then. I know there's been issues with the UK portal, and we've been putting out communications to say actually our local capacity for testing is fine across the 3 counties. The frustration is getting through the UK portal, and Alison again is leading on some work locally to try and build a more hybrid system so that we can work alongside the UK portal but be able to offer local testing where we have it. And that's going to be important, I think, as we go into the winter to keep on top of things. And of course, the hospitals are and our clinicians and frontline staff are much more familiar with this virus now in a way that we weren't previously. I was talking to some clinicians in Prince Philip this week, and they know how to spot it better. Of course, our protocols have been better rehearsed than they were back in February and March. And we are confident in the level of PPE we've got, whilst not being complacent, because we know how supply chains can be disrupted quite quickly. But right now we've got good supply and a good pipeline coming in, which made us all very nervous in the early days. And in the background of all of that, of course, we have our field hospitals. We've been working with the local authorities and Parker Scarlets and Bluestone over the summer, and we've got ourselves into a place now where we have enough field hospital capacity, about 500 beds, should we need them. I pray that we don't. I'm hopeful and optimistic that the test and trace process, that the access to testing, that our protocols and things will mean that we'll never get to needing them. But we have almost immediate availability for 500 beds should we need them into the winter. Of course, staffing will be a challenge, but that's something that the Workforce Bronze Group is working through, and we have some plans in place to try and help with that. If you're interested, all of this went to board yesterday. There's a COVID update paper and loads of attachments. They're there really to show broadly where we're going on all of these things, but also if you wanted to jump into the detail of some of our local plans, then they are all there. So if you get a time, or if you want a bit of reassurance or knowledge about what we're doing, then please have a look at those. And I guess I would finish by just saying, whilst we all may be feeling a little nervous right now and wondering what might be coming, what got us through to this stage has been your amazing kindness and compassion, both for each other and looking out for each other, and also for our local population, the population that we serve. that's what will carry us through again. So please look after each other, look out for each other, show those acts of kindness, because in the end, we are all in it together, and we will pull through together and come out of the other side of this a stronger organisation, an organisation that's much more together. So, as always, thank you for all you're doing. Get rest when you can, and I look forward to seeing you if I'm out and about. I'm trying to get out to all of the hospitals and into our community services. I look forward to seeing you if our paths cross out there. But thank you.